Hi all, we are here at the 7th European Aniridia Conference in Stockholm, Sweden. 3 days of work to talk about the future of treatments, research and surgical technique innovations for Aniridia. In this moment we are together with Lagali, who is Professor of Ophthalmology at the Linköping University in Sweden. Thank you for being with us.
Thank you so much for coming here and allowing me to talk about this conference.
So about this conference, we want to know the most important results, the most important highlights. Can you explain us what was told in these days of conference from all the parts, so from the anterior segment, posterior segment, and also genetics?
Sure. So we started with, we try to have a very balanced conference about all the parts of the eye, and so we talked about glaucoma and the importance of glaucoma. And so we had some very good speakers there, and some of the new devices coming in for managing glaucoma, which I think is important. And this can be applied to Aniridia in the very near future. And then we had a session on surgery and surgical for the cornea in Aniridia and new surgical innovations. So this is also very important, and also important to communicate the strengths and the weaknesses of surgery, because it's not always the best option. And so communicate some good and some bad experiences also with this. We also talked about the iris and the artificial iris, and we know that this is always a question that's on the minds, of people with Aniridia and their families. And we presented some results from some studies on the iris that we had from the COST action, and showing that there are a lot of risks associated with this, and risk for developing glaucoma, for example. We also had some posterior segment talks talking about the importance of the foveal hypoplasia, about how to make sure that you do a proper examination of the eye, and even it doesn't matter if it's a full iris or a partial iris, you still have to look at the back of the eye to really see what the fovea and to assess the fovea. So that was, and then we had session on gene therapy, and gene therapy a lot of people are talking about now, because this is sort of the future and the next sort of line of treatments, and there we talked about, it's not here yet, but there's a lot of research happening, and hopefully soon this can be applied in ophthalmology and specifically for Aniridia. And we had also talked a lot about about Aniridia as a syndrome. It's very much now we're getting on the agenda that the researchers, the doctors even, are starting to talk about and getting more aware that Aniridia has a lot of effects outside of the eye. And so this was a very important theme in the conference as well. And then finally we had a very nice session today on new technologies that could help with Aniridia. And these technologies, in the broadest way, this could mean new models of the disease to help therapy development, so new medicines development, and translating what we find in our models to first human trials, and also new devices like an amniotic membrane that doesn't require surgery that you can apply to the eye, and a iris that's built into a contact lens, a scleral lens. So these are some of the new technologies that are coming.
We saw also some new entries, we can say, something like the narrative medicine, and as you said, also this analysis of blood that helped the researchers to understand that there are some moleculars and some cells that are impacting from the PAC6 due to Aniridia, also other part of the body, and other symptoms a part of that linked to the eyes. So what are, according to you, the new priorities in order to have always a better treatments for Aniridia?
Yeah, I think we'll take the second one first. I think with with the new technologies, like they showed metabolomics, so looking at the metabolites in the blood of patients with aniridia, and how this is giving us insights into all the systems that can be affected and what's happening actually in the whole body. And I think that's really important, and what's coming out of that is a better understanding of that we have things going on in the body, like oxidative stress is one big thing that's happening, and even this has led to suggestions for future treatments for antioxidant type of therapy, and we know that in the eye that's important as well. And we see signs in aniridia patients that there's under more oxidative stress. So this is one good point. Another point is that the connection between insulin, for example, and insulin resistance in diabetes patients, that is also seen in the blood. So we have to start being more careful of. We know that this could lead to a pre-diabetes state. So this is also important for management of aniridia. So I think those kinds of analysis are just giving us more and more information and insight into aniridia. It's only going to help the doctors to treat the person as a whole.
Also from other researches there are, for example, the connection between the axis and the brain, and what they are the impacts for then the interaction or the capacity of interaction in more sides from the patient.
Yes, that was also a very important session we had, and discussions all days about PAX6 and the brain, and that it has effects in many different parts of the brains, and this results in direct impact on things like the pineal gland, which controls melatonin, affects sleep, so sleep disturbances, also parts of the brain that are responsible for the sense of processing sounds and also smells, so this is also controlling appetite. So there's many things that people and families with aniridia, they know of these things, and now science is just starting to catch up and see that yes, these are real, and there are things that can be measured in the brain that are showing this. And I also want to come back to your point about narrative medicine. This was a really important point in this conference too, because we're starting to see both narrative medicine and also quality of life to start to look more at things beyond just the vision, and how the disease is impacting the whole life of someone and their families, for example. So we're starting to get a bigger picture of this now, and this is really informing the doctors in a much better way and informing the researchers in a much better way. So
could be this the next step to have a good a better treatment on aniridia, because you can try to consider aniridia as a syndrome, but we need to consider aniridia also from the patient side, and so all the people around of the patient.
Yes, absolutely, and this is something that we are really seeing in our results from the narrative medicine study, that how important the care is and how patients are met and what kind of support they get. And this is really something that we're going to publish this. We're going to take this back to the healthcare system and see where we need to improve on this. So because there has never been a study like that done before, and not only that, I think it's the narrative medicine, but also the quality of life. We had discussions here about quality of life and also a vision, but in vision we're not always maybe looking at the right things, because the doctors always want to look at visual acuity, visual acuity, right? But vision is so much more than that. And so I think we're starting to broaden this definition of what is a good outcome of a surgery or a good outcome of a treatment, and it's more than just the visual acuity. And so I think this is, we're starting to have these discussions now and opening this up, because even in trials for new therapies and new drugs, we want to see, does it really impact your life? Does it improve your life? And that's more than just your visual acuity. Yeah.
So we hope this, and obviously the next time we maybe will meet in Bulgaria, and for the next conference. So thank you for your hard work on this conference and with the scientific committee for being with us today.
Thank you so much. It really was a pleasure, and really it's also something that's very close to my heart, so I'm very happy to do this and to be involved, and I really look forward to seeing you again in Bulgaria. Thank you.